Instagram's all right. Facebook. Oh God. Oh. I shouldn't have done that. Facebook, it looks like I've cut myself shaving, doesn't it? Where is it there? Doesn't look so bad on Instagram, but that's not good, is it? Plastic surgeon. I'll be your surgeon today, and I cut myself shaving. I didn't even notice I did that. But that is one of the benefits of wearing a face mask. Evening, Olivia. I'm going to assume my audio is working. I'm assuming that because I'm a professional, and professionals don't say, "Can you hear me?" All right. Professionals just assume. So I'm not going to say that because clearly I'm a pro. And this is a Q&A session, in case you're wondering what it is. But I think Olivia, Khan, and Tracy all know what's going on. Exciting news, guys. Very exciting news. I have started operating as of aujourd'hui. Oh, hold on a minute. Can't hear you on Instagram. Oh, audio's working on Facebook. That's unusual, isn't it? Oh, is it because I've muted it? Does that make a thing? Where's the mute button? Where's the thing? Right. Oh no, that's mute. Ringer. Do I need to turn the ringer up? Right. Who knows what to do about audio on Instagram? Not me. I've got to be honest with you. Instagram doesn't have many features. What's that button there? Oh, that's good. That's sharing a photo. What's that? That's those faces. That's go live with. What's that? Don't know what that is. Questions. Oh, questions from your viewers will be shown here. Oh, I should have done one of those. Can't hear you on Instagram. Well, Facebook can hear me. Any ideas? Anyone on Facebook know what I can do about the audio not working on Instagram? Could Google it, couldn't I? Ooh. Right. Jackie, can you hear me now? Can you hear me now? Can you hear me now? Jackie or anyone? Can you hear me? Can you hear me? Is it working? Can you hear me? Is it working? Can't hear you on Instagram. I've moved to Facebook, was on Instagram. I've got a question. Is it better to keep up here? Oh, God. Olivia's straight in with the question, guys. No, you can't hear me. You can't hear me. What shall I do? What shall I do? What do I do? What do I do? Don't know what to do. I'm going to leave and come back. I'll be back in a minute. No, I'll be back. I'm going to leave and I'll come back. That's what you do, guys. Anyone who knows anything about, oh God, about IT, what do I do? Share to IG. I don't really want to share that to ITV. I'm going to delete that video, shall I? Anyone who knows anything about IT knows that when it don't work, you leave and you turn it on and you turn it off again. Boom. Instagram, can you hear me now? Hello, Instagram.
Instagram, can you hear me?
Yes. Turn it on and off again. That's how we do things around here, guys. That's how we do things. IT team, good. Right. I think it's because I was doing a sunglasses thing before I started and I'm, sorry about that. Right, we're back in the room. So we're straight in. Turn it on. Tracy says turn it off and on again. That is exactly what I did, Tracy. Exactly what I did. And it is absolutely amazing how often that does the trick. Olivia's straight in with a question. Is it better to keep up painkillers or to not take them unless necessary? I have got a view about painkillers, and my view about painkillers is that you do not take them unless necessary, because I feel that painkillers can cause problems. I'm gonna preface it, is it, or I'm gonna say something again afterwards in a minute. So don't cut it there. So I think there is something going on the bottom of the screen, isn't there, which is quite tedious. But do please comment and share, by the way, PD. Can you comment? You can comment on Instagram. Can you share? You probably can't share on Instagram, can you? But please comment on Instagram, and please comment and share. My view is that in general terms, I tell people not to take painkillers unless they have to. I'm not one of these people who would say, oh, take, painkillers, and, I don't think you should take painkillers regularly if you're not in pain. Now, if you are in pain, then it can be good to take them regularly to keep on top of the pain. So you don't want to, you've got to titrate it. So if you are in pain and you feel that the painkillers are helpful, especially if you've got an immediate cause for the pain, i.e. post-op. So if you're post-op, obviously it might well be a bit sore to start with. And so it is good to start with the painkillers regularly if it's bad, and then titrate them off. But I would always say to try and reduce them as quickly as you can. And if your pain is controlled and you're not in much pain, don't take them just for the sake of it. And that is why you've got to be a bit careful, because sometimes you get them and the box says, take 2 4 hourly or something like that, or 6 hourly. And so people religiously take them like that. But if you're not in pain, then I don't think you should take them, because they can cause problems, particularly codeine-based ones, cocodamol, coproximol, codeine phosphate, those sorts of ones, tramadol, buprenorphine, anyway, Temgesic, I think that's the same as buprenorphine, isn't it? Anyway, the opiate ones, because they can make you constipated, they can make you dizzy and woozy, and they can also make you feel sick. So they do have side effects, and constipation particularly can be worse than the pain. So you've got to be careful. So if you are needing to take regular painkillers, keep yourself regular, fresh fruit and veg, etc. But I would say that see how you go, and if the pain's not too bad, I would think about titrating them down and not taking them absolutely regularly. But if the pain is bad, then it is good to keep on top of it. Joe can hear me on Facebook. Good. And I think I got reason to believe that Instagram is also working, which is a bonus. What's the normal recovery time with swelling after a big thigh lift? Well, always best talk to your surgeon. But it depends what you mean by recovery, really. I mean, skin's probably going to be healed in a week, 4 to 10 days. Skin's going to be healed, although there's sometimes bits for big sort of body contouring surgery. There's often bits that don't heal up as well, and you get little bits and bobs. But the skin's probably going to be healed within the first, week to 2 weeks. Underlying tissues take a good few weeks to getting it together. And swelling, etc., again, takes a good few weeks. So I normally say around sort of 4 to 6 weeks, you're going to start to get knitting together. So you're going to get this, the strength coming back in the wound, so you can start getting back into things. And then things really start about 3 months. And they can take 6, 12, even 18 months to properly settle. But around 3 months, things start to settle. Come on, Instagram, what's going on? Only paracetamol taken. Good. Why is it you don't recommend compression after a thigh lift? It's not that I don't recommend compression after a thigh lift. I think compression is good and it can be supportive, but I think it is difficult with the thigh, because the problem with compression is that it has to start and stop somewhere, and ideally the compression will start and stop past the area of surgery. So for instance, if you're doing a tummy tuck, the compression goes below the scar and goes up to here, and the whole area of surgery is included in the compression. When you're doing something like a thigh lift or a arm lift, it is hard to get the compression to get either side, because you've got an elbow and a shoulder, and you've got a knee and a hip. You've got those joints, and the thigh lift and arm lift often go all the way up to the armpit or up to the groin, and you can't get compression going past that joint because then you won't be able to move your hip very well. So the compression garments always have sort of gaps around the armpits and the hips, and you can get a lot of swelling in those gaps. So that's the problem I've got. I want the compression to completely encase the area. So that's why I don't. I'm not a massive fan of these compression garments because they're often quite big and massive great things that are quite hard to get on and off if you're gonna get compression there. And as I say, that in the areas where there's no compression, you can get swelling. So that's where I am on that. But as I say, everyone's different. Some people will use compression, I'm sure, and will have a real have a reason to use that and have a I'm sure get good results with using compression as well. So there's no right or wrong. It's just everyone's personal experiences and patient's experiences. It's a weird uncomfy depending on which position I'm in, not pain as such. Good. Wounds are healed. Good. So excited. Arranged my update today. Tracy, I am so excited for you because things are starting to happen. We've done some surgery today. All right. I mean, I have been doing surgery until now. I have been doing minor ops at my clinic, but I haven't done anything sort of bigger than a minor op. So we've started. Let's be honest here. I have started today, and we're doing some local. Just me. Local sedation cases today, and I've got more booked in a. Is it next? Sounds bad. I've got more booked in a couple of weeks. I should be operating every week, shouldn't I? Is it next week? No, I think it's the week after. And then we got some GA cases in October. So is that you, Tracy? I think it might be. So that is awesome. Oh, God. Thank the Lord. But I got to be honest with you, it is not looking good at all. And it's certainly for the GA. But anyway, but it's great to get things moving. And I'm very, very excited. Celie, hi dude. Hi Celie. Celie, the other thing is I've just done an Instagram thing. It all went wrong, so I had to stop it. So when I stopped it, it said download video or something. So there is an option to download the Instagram there. I've never noticed it before because I never really looked. But anyway, that's probably not helpful because I think you were trying to download. Were you trying to download your Instagram or something? So anyway, so yeah, that's perhaps not that helpful to you if you've already done it, but maybe for next time when you finish your Instagram, there is a thing that says download video if you wanted to do that. So Instagram's got a question, which is exciting. What happens after when you get lumpy 6 weeks after liposuction? Will the lumpiness go down? Mad laminid. That's one of the problems with liposuction, mad laminid. And you can get lumpiness. And I'd say 6 weeks is early days. 6 weeks, you're looking at healing. Swelling might be starting to settle. It's early days, and you often get lumpiness with liposuction. And I would, and you're saying, will it go down? First of all, stick with your surgeon, unless I'm your surgeon, in which case do what I'm about to say. But talk to your surgeon. But my advice in that circumstance is that it will change and it will be different in a few months' time. So I hope it will be a lot better, but it might not be. There might be still lumpiness, or there might be some issues, but it will be different. So don't make any long-term judgments at 6 weeks. 3 months is the minimum before you start thinking about what's going on. And really 6-12 months for everything to properly settle. But it is not unusual to get lumpiness, contour irregularities, funny feelings, all sorts of bits and bobs going on with liposuction. So do I still carry on wearing the garment? Do what your surgeon says. And if your surgeon's me, no, 6 weeks you can start taking it off and getting into exercise. And but if it's uncomfortable, if it swells, then put the garment back on again. If the surgeon's not me, then you better do what your surgeon says. But I would say after 6 weeks, you can start getting back into stuff, although the swelling will still be there. As I say, the swelling's there for 3 months, but I think it's quite a big deal to say wear your garment for 3 months. Very exciting news. I have got a question. I've got this little one by my question thing. Oh, it says, I've just asked a question. Okay, right, that's Mad Lamid. Awesome, that was good. So the question thing works. So what's the difference in questioning and just answering a question? Anyway, that's good. I think I could put a sticker that says "Ask a question." Ooh, hearts. Wow, thank you. Good luck, Madlamin. Madlaminid. What's going on? Hi, dude. Is it necessary to have a blood thinner post-surgery after a tummy tuck? I've recently heard this is important to prevent a blood clot. Is this true? Yeah. Yup. Pretty much, Liz. Pretty much. Yeah, I would say so. I mean, everyone's different, Liz, and we all have our own regimes post-op. And obviously, well, maybe not obviously, but there's a balance post-op in terms of blood thinners, because we don't want you getting a DVT, which then can go to which is a clot in your legs, which can go to your lungs, which can be really damaging and a really bad complication. And it's because you're immobile. When you're having surgery, you're immobile. And there's a risk that these clots can form. But obviously, you've just had surgery. So when you have surgery, there's a risk of hematoma, which is blood collecting in wherever you've had your surgery. So there's a balance there. We don't want to thin your blood so much that you never cause any clots, because we want you to clot in your wound. We want you to clot in your tummy tuck. So a tummy tuck's a really good example, because a tummy tuck's is quite a big op. There's quite a big space. There's quite a big risk of hematoma and blood collecting, etc. And so you might say, well, we don't want blood thinners in that case because it'll be a disaster. But at the same time, there's quite a big risk of DVT. And DVT, particularly because you're putting pressure on your tummy, which is going to reduce the venous drainage from your legs. So there's an increased risk of DVT with any surgery, but it's even higher with a tummy tuck. So personally, again, just me, I do worry about DVT, particularly with tummy tuck. It has got a high risk. So I am more worried about DVT than I am about hematoma. So I do give people the thinning things. It's called heparin. I do give people the thinning injections after a tummy tuck, because I am very worried about DVT. Other operations where perhaps you might be less worried about DVT, i.e. shorter operations which haven't got pressure on the tummy, you might be less concerned about DVT. So you might just go with early mobilization rather than giving the blood thinner, because you might be the risk of hematoma might be more of than the DVT one. So it's always a balance, because you don't want to give too much blood thinner because you don't want them to bleed, but you don't want to give not enough blood thinner because you don't want to clot and cause a clot. Always a balance. Good question, Liz. Gold star to you. Thank you for that. So, and again, surgeon preference, and there's no answers about it, but I think it is good practice. And the other thing is, I say surgeon preference, there are guidelines about these things. And the other thing is there are other measures as well as the blood thinners. TED stockings, Flowtron boots. TED stockings are those white flight socks things. Flowtron boots are things that go around your calves that blow them up and down. And probably as important as all of this is mobilizing, which means moving your legs, moving your hips, moving your bum, keeping everything circulating. And the best thing you can do is walk. So we try and get you up walking day one, probably not the day of surgery, but the next day we try and get you walking the next day. That's what we do. I don't think there were seagulls. I think there were geese. They sometimes go in that V, flying geese, pet geese. Right, so we've got some questions. That's Helen K. What causes capsule? This is on Instagram. I mean, this is fascinating. We've got questions on Instagram and Facebook. I mean, this is the holy grail of social media engagement, honestly. Next thing, I'll be having questions on YouTube. God knows how that works. What causes capsules from breast implants to be stuck to the ribs, and is it difficult to then remove? Thank you. Ooh, capsules stuck to the ribs. Ooh, sounds nasty. Well, capsules stuck to the ribs, Helen K, is really when you've got a submuscular breast augmentation. So obviously, if you've got I keep on saying obviously. It's not obvious, is it? Anyway, if you've got implants on top of the muscle, then the posterior capsule, the back of the capsule, will be stuck to the muscle. But when you've got implants underneath the muscle, then the front of the capsule will be stuck to the muscle and the back of the capsule will be stuck to the ribs. So therefore, so what causes it to be stuck to the ribs? Well, the capsule is scar tissue. It's scar tissue that forms around the implant and it's stuck to everything. Scar is stuck to everything. So it's stuck to the ribs, it's stuck to the implant, it's stuck to the, stuck to both sides. So that's what scar tissue does. It sticks to everything. And that is a problem, or a potential problem, with a submuscular capsulectomy, because the ribs are right there. And what's something behind me? But I think it might be a reflection. It was my arm. It was my arm reflect. God, that's weird. Sorry, I digress. So the capsule is the posterior capsule is stuck to the ribs, and so the risk is that there is actually a risk of pneumothorax, a risk of actually making a hole in the covering around the lungs, because obviously between the ribs there's the intercostal space, and then through there's the lungs. So there is a risk to that, to make a little hole there. Not quite as disastrous as it sounds, but still, not great. So for that reason, when someone's got an implant under them underneath the muscle, sometimes people will leave the posterior capsule because it can be quite hard to remove. And if the ribs are there, well, the ribs will be there. So there's a risk of making a little hole in the pleura around the lungs. So I hope that's... Is it difficult to... So yeah, it is difficult. So a capsule is difficult to remove anywhere, but I think that's where you've got to be more careful when they are submuscular and the posterior border. So sometimes people will just take the anterior, just take part of the capsule, maybe the anterior part, and leave the posterior part alone and just say, leave that alone, mate. I'm not going nowhere near there. I've got the ribs. Sometimes people do a total capsulectomy. All depends how bad the capsule is, what sort of implants you're replacing them with, what plane you're replacing them. So if you can maybe changing plane, then you'd be less worried. And, multifactorial what you do to the capsule, but it is an issue with submuscular. I hope that's been helpful. Good question again. We've got some crackers in tonight. What's going on over here? Celie, can you do the filters? I can't do them on... I've got fancy software, Celie. So I've got this name, your name is here, and all that. I can't get it right. Anyways, there. So I can't do those funny things. I can on Instagram. For instance, it went all dark a minute ago. Tap to try on. Right, see, I can do that on Instagram. Not quite sure. Right, street. Oh my God, what have I done? Nice one, Celie. Look what you made me do now. Oh God. Sorry, that was Celie's fault. I don't know what was going on there. Sorry, I thought it would just put some dark glasses on me. Anyway, I can't do it on Facebook because I've got top of the range software. Olivia, thanks, JJ. I've started wearing compression fabletics leggings for about 2 hours a day. Good on you, Olivia. That sounds good. Compression fabletics leggings. Like the sound of that. What length of time for the GA surgeries? Can you do a tummy tuck? Yes, I can, Olivia. Woo, woo. I can do a tummy tuck. I can. So I am unusually excited about that. You take things for granted, don't you? It's amazing. It's like, what's it? Maslow's hierarchy. Is it Maslow's thing where you... Anyway, take things for granted, basically. And yeah, I mean, just doing a normal case in a normal operating theatre would be amazing. Be great. So yeah, great, fabulous. Thank you. Sorry about the dark glasses thing. I didn't work as I'd planned, but that's the thing. You can't test these things. You're amazingly helpful. Look at that. Oh, what a sunshine that is. What a sun. That's so kind of you to say. That really has lit me up like a star. Oh my God. Where have I gone? Oh, there, I'm back again. Hello. Oh, God, I'm so tired. Right, coming back up. Hello. Are you still there? What are you still doing there? Well, I got to go now. Bye. Right, okay. That's enough of that. Come on. Oh, God. I've got to get it off now. Fully trained professional I am. All right. So, oh, God. What's happened now? Right. Stop it. Keep to the plan. Keep to the plan. Right. What's going on over here? Olivia's wearing fabletics, which is very exciting. Celie, in some of my WLS groups. Oh, crikey. Another TLA. WLS. Okay, well, let's move on, see if it becomes any clearer what WLS is. I have had so-called influencers like myself, I'm sure, recruiting for surgical tourism. Oh, that's not me. No. I'm so worried. Honestly, I don't like this trend. And living next to Gatwick, we see lots of walkie wounded straight off the plane. Can you tell me the extent of concern? Well, yes, there is quite an extent of concern, Seeley, amongst the plastic surgery community of cosmetic surgery tourism, and it does put a bit of a burden on the NHS because there are obviously, if there is an issue, it can be taken on by the NHS. Now, I've got to be honest with you. I don't want to be I don't advise people to go abroad for surgery. I advise people not to go abroad for surgery. Same thing, said a different way. And not because the surgery's bad or the surgeons are evil people trying to harm people. I think everywhere you go, surgeons are trying to do a good job. And I think there's some very good surgeons. Well, I don't think there are very good surgeons all over the world, obviously. And so but I think there's a couple of issues. One issue is we don't really know the level of training. We don't know the level of infection control, hygiene, insurance, all these things in terms of the clinic in those countries. In this country, you can say to people, oh, go for a place that's CQC registered, go for a surgeon who's fully trained, all these things. Whereas in other parts of can't hear you again. Oh, you're kidding me. Are you kidding me, Joe Molly's off? What kind of name is that? Joe Molly's off the alley. I lost sound. That's your fault for making me do the thing. There, is that better? Or did I have is that better? Can you hear me now? Can you hear me now? Or not? Might as well put a funny face on if you can't hear me. Can you hear me now? Can you hear me? Is it working now? Yes, it sounds working now. I'm back. Right, good. Thank you. Right. So I think that just looks a bit normal, so I think I might take that off. Sorry, I think it's because I'm messing about with these masks. There. Oh my God, don't tell me I've got to keep... Not now. I've got to keep the mask on. I've gone again. So you can hear me when I've got that funny mask on. Can you hear me now? Oh my God. I'm sorry, Facebook. I'm sorry about this. I will ask about the WLS. You can hear me, so I've got to keep this mask on. I've got to keep this on. Have I got to keep this on? I'll keep this on. Okay, I'll have to keep this on for the rest of the thing. I can't take it off. If I take it off, the sound goes. Right, I'll keep it on. Oh my God. Honestly, the things I do I can't take the mask off. Right, I'll leave it on. It's fine. So yeah, it is a worry, cosmetic surgery tourism, because you don't know the level of training, etc. Can't hear. You having a laugh? Are you having a laugh? You're having a laugh with me now. Can you hear me? I'll take the mask off. Right, masks off. Can you hear me with the mask off? I thought you could only hear me with the mask on. Can you hear me with the mask off? Can you hear me now? I've taken the mask off. Taken the mask off. I can always leave and come back. I shouldn't have messed with the mask. Seeley, you've asked me to do the masks and I've just messed it all up. Can you hear me now? Mask off, can hear you now. Right. Leave the masks. All right. Step away from the masks. I'm sorry about that. Okay. Right. The mask is off. They can hear me. Right. Exhibit A. Don't know training. Don't know infection control and indemnity insurance, etc. And also there was another reason. What was it? Oh yes, traveling. Traveling is not great around surgery because it increases your risk of DVT, which is talking about DVT and tummy tucks and stuff. If you're doing traveling in a plane, increases your risk of DVT. So you don't really want to I'm not wearing it now, thank you. All right, that's that sort of comment. I'm not wearing the mask. DVT increases your risk, so you don't really want to do that. And also the thing I mean, I don't know what's happening. I'm not wearing the mask. No, I'm not. This is my normal face. The thing that happens with that you've got to look into, and really, I think this is why, as plastic surgeons, we have to educate the public and say, look, you've got to, these are the questions and things you've got to ask. So what I would be saying is you've got to ask them, what would happen if you got a problem? You know, could you see the surgeon again? What if you need a revision? What if you have a complication? What if you have an infection? What if you have a hematoma or a seroma, or if the implants aren't sitting right, or if you have a dog ear, or if you have this and that? You know, what is your recourse? Because we sometimes get people who contact us and say, look, I had surgery in somewhere abroad, it doesn't matter, and I'm, you know, worried about the scar, or I'm not happy with something. And I'm like, you know, we can't, well, you don't say we can't, we could, but we don't help, because it sounds bad, we don't help. But you know, the onus is on the surgeon to get it right, to get things right, and to sort out any complications. And you will be hard pressed to find a plastic surgeon who will look after you, because we are just, I've said this before, we're just paid for the surgery, and the aftercare is just part of the surgery. And we, you know, that is how we work in this country. And I don't know what it's like in other countries, but certainly in this country, you only really pay for the surgery, and then the aftercare is sort of part of that. So although you might be thinking you didn't miss much, Celia, I don't think. You might be thinking that you could have follow-up. You might be thinking that it's expensive to have surgery, and it is expensive to have surgery, but this, and you might think, oh my god, he gets paid all that money and he just spends an hour or 3 hours in theatre. But it's not just 3 hours in theatre. You only get paid for that bit, but then all the follow-up is part of the deal. And so that is one, or that might be one of the, a lot of people say, why is it so much more expensive in the UK than it is in other countries? That might be one of the things. I don't know what other countries do. Now, you might have a fantastic aftercare setup with and have surgery abroad. So I'm not saying that it's bad when you go abroad. I'm just saying these are the things you've got to look at. And if you have a problem, can you access that surgeon? Can you access that facility to get help, to get advice, to have someone help you, or see you through any issues you might have? And that is certainly a large part of my practice is the aftercare. I mean, it's about looking after people. It's about touching base with them and checking they're okay, and allowing them to touch base with you and to come back and see if they've got, you know, see how it's all healing, and keep an eye on everything. And so I would be looking at someone who would be able to do that. How do we get onto this? Oh yeah, it was a WLS groups, WLS. Yeah. So don't know what to say. I don't know what the recruiting for surgical tourism sounds pretty hardcore. Anyway, thank you, Celie, and I'm sorry to hear that you got recruiters in your WLS groups. What's going on here? Okay, people tell me it's okay. The NHS will fix, and tell them, no, we will make sure you don't die, but we won't make you happy, just healthy. Yeah, I mean, a bit harsh. I mean, the NHS will. I mean, really, it shouldn't. I mean, the NHS will, if you are got a raging infection, and if you're, you know, in a lot of pain, and if you're got a real problem, yeah, the NHS will help you. But really, if you've paid for private treatment, you would probably want to perhaps be looked after in the private sector. So the NHS will, and the NHS will get you through the problem. So if you've got an infected implant, they'll remove the implant, perhaps, you know, or they'll you know, wash out the wound or something, but they won't necessarily get you to the end, because they'll just get you over the acute problem that's at hand. And it's just not ideal, I would say. It's not ideal, you know. And as a surgeon, I wouldn't really want someone to be looking after my case, to be washing out my hematoma, or to be, you know, treating my infected case, or whatever it is. you know, I want to look after it myself because I know what's going on. I want to make sure you get the best result, and I don't want some other person or surgeon getting involved and doing things because I'd want to look after myself. And I think most surgeons are like that. I think it's a thing, honestly. When you pay 2K for surgery and you fly back from Turkey with a indentation, yeah. It's a funny old game, Seeley. It's a funny. They'll make you not die, but they won't save your nipple or breasts. I mean, I hope they'd save your nipple or breasts, Seeley. You know, but I think, yeah, I mean, I think that's it. The bottom line, if you think you're going abroad, look at what the aftercare is and look at what would happen if you had a question or a concern. Yeah, because, yeah, that's what you've got to be looking out for. So, Haley Cheshire, I had phlebitis 12 years ago when I had my son. Does that make me more at risk of DVT after a tummy tuck? No, I don't think so. I think you would have probably had phlebitis in your superficial veins, which are sort of closer to the skin rather than your deep veins where a DVT happens. So, no, I don't think so, Haley, but still, you know, DVT is a risk after a tummy tuck with anybody, but I don't think that puts you at a higher risk. Oh, infection, not induction. Yeah, you don't want to come back from Turkey with an infection. They will try, but it's not a given. Yeah. It's just not ideal, is it, Seeley? It's not ideal. But then I guess that's why it's cheaper. Maybe that might be one of the reasons why it's cheaper. And you have to balance it because not everyone can afford this and that. I suppose you've got to balance what you can afford versus, you know, results and aftercare. Should I still be elevating legs overnight 4 weeks after surgery? Olivia, this is something for your surgeon. See, this is what we're talking about. You need to speak to your surgeon. So you need to say everyone will have their own post-op regimes. So it's not for me to get involved with other surgeons' stuff. We all have different advice. Some will say elevate for 4 weeks. Some will say don't elevate at all. Some will say 6 weeks. Some will say for this many weeks and then at night. And so all this sort of stuff. So I think you've got to just go with your surgeon, I would, on that one, because that's, 4 weeks after surgery is quite soon. So this is something your surgeon needs to be working with you. Kim, do you feel annoyed or frustrated at having to fix/sort out problems from other surgeons abroad? Well, I wouldn't say no. No, I don't feel annoyed or frustrated because I mean, I think we can all have problems, and I as I say, I wouldn't get involved early on. I think the surgeon needs to get involved early on. But if someone comes to see me years after the surgery and they want some revision surgery, then I'll do revision surgery off anyone, off people abroad and people in this country. I mean, we all require revisions. And as I say, I don't think surgeons abroad are trying to do bad work. I don't think anyone's trying to do bad work, but anyone can have problems. So you can sometimes need to have revision surgery. So no, I don't. No. People are people. We're just treating people, Kim. We're treating people. We're helping people with a problem. That's what it's about. So it's the patient. So you don't want to take it out on the patient. You know, if you've got a patient with a problem, it's not like, oh, I'm annoyed because this was an overseas surgeon and he did it all wrong and he did the wrong thing. It's not going to help you, is it? If you're the patient, you're like, flipping, I didn't know. I just went for this operation. I thought it would go well, and it didn't go well. Oh, good God, I've lost everything. No, it's all right. And it didn't go well. And it's all a bit wobbly and I'm not quite happy with it. So can I help? So I've got to think, can I help you or not? Simple as that. If I can help you, I'll help you. If I can't, I can't. And I will treat you, not your story. Put that strap line for the clinic. We treat you, not your story. Yeah, write that down. Make a note. Olivia, what point can I start sleeping on my side post thigh lift? Olivia, talk to your surgeon. Olivia, talk to your surgeon. Ask them. I don't want to get involved. I'd sleep on the side at any point after your thigh lift. I haven't got a problem with you sleeping on your side after a thigh lift, but presumably they have, because you're asking at what point can you sleep on your side. So you better go with them, because I don't want you sleeping on your side. Then you go back and you have a problem, and he says, you're sleeping on your side. I told you not to sleep on your side for 15 weeks. Yeah, but I got on Facebook, and there's a guy on Facebook told me I could sleep on my side, right? Don't just do what he says. Don't ask me. Jackie's lost Instagram. Oh, geez. Instagram, are you there? Instagram, come in, Instagram. Is anyone in? Of course, it might be there's no one actually on Instagram. If there's anyone in Instagram, please show yourself now. Has Instagram gone? Has Instagram stopped working? Do I have to do something? Shall I say something? Oh God, what's this? What have I done? I was going to type something. I thought I could type something. Okay. Okay, not a problem. Not a problem. It's fine. Comment. Can I not comment? Link up. Oh, Jackie, is that you? Oh, you're back. Am I back? Am I on Instagram? It's working. Right. Okay, good. Whew, that was close. Almost lost half my social media influence there. Honestly, I mean that we could be talking some serious coverage. Almost got lost. If I had lost Instagram, that would have been a serious hole in my numbers of viewers there. Honestly, right? Okay. Naja's on Instagram anyway. Good on you, Naja. Thank you for commenting. Very kind of you to be involved. Stephanie says, I've lost 7 stone in weight and everything's going south. Would I be a good candidate for a tummy tuck and breast lift with implants? Sounds like it, Stephanie. Yeah. 7 stone. Wow. Well done, you. So, number 1, have you finished losing weight? If you haven't, carry on going and don't have anything done until you've finished. Number 2, tummy tuck often is the case with 7 stone weight loss. Breast lifted implants depends on what you're after. If you breast lift, quite possibly, because if everything going south, a breast lift is the thing that stops everything going south, or at least brings it back up north. Implants depends on the size. Whatever size bra you wear, if you want to wear a bigger bra, then maybe a breast lift and implants. If you're happy with the bra that you wear, but you just want the shape to be made better, then maybe just a breast lift on its own. This is something we could talk about in the clinic. But yeah, I would say tummy tuck and a breast lift, implants if you want to be bigger, for sure. And well done on your weight loss. That's awesome. WLS is weight loss surgery. Ah, I knew that. Yeah, of course. That was a WLS group, right? In some of my WLS groups, weight loss surgery. Yeah, of course. We all know that. All plastic surgeons know that, obviously. Any plastic surgeon worth their salt would know what WLS is. She thought I didn't know what WLS was. Thanks for that. Yeah, no, I didn't know what WLS was. You're quite right. Did it show? Obviously, it showed. Thank you. Weight loss surgery. Thank you. WLS group, honestly. Olivia, oh my God, here we go. Olivia, what are you asking now? That's the problem with the foreign surgeons. Can't really ask these questions. Well, Olivia, that's one of the issues, isn't it? So thanks. It's a lonely place to be, probably with surgery abroad. Well, anyway, I think if you're going to have surgery somewhere, you've got to make sure that you've got access to help if you need help with questions like, when can I sleep on my side? How long do I need the garment for? Is this normal? Does this wound look okay? You know, all these things are very important to sort out before. Well, it's not helpful now because you've gone already. But anyway, you know, what can you do? I don't know what to say. Greg's in the house. Hi, Greg. Nothing to see here. Move on, Greg. Greg's take notes, Greg. You want to be an influencer like me? This is how it's done, my friend. Right. This is where it happens, right here. Okay. Right. So Kelly says, hi, Greg, I'm on Facebook as well. So I just want you to know that my reach is doubled. I'm on Facebook and actually YouTube as well. So, you know, that is what happens. Thank you. Yeah, that is what happens. You know, keep your nose clean. You stick with me, you'll go far. So yes, Olivia, so I'm sorry to hear that, Olivia, but good luck with everything, and I hope that you get answers to your questions about your swelling and your whatever else was the thing. Oh, TikTok, I forgot. God, I've totally forgotten about TikTok, Greg. I have totally forgot. My God, do they delete your account after a while? I haven't. I've got to do a TikTok. It was all right in the lockdown. We had time in the lockdown. Oh my God, TikTok. Dear, oh dear, what are you supposed to put on TikTok? Please tell me, someone. Honestly, have I got to mouth the words of a song? Is that what you got to do? I don't know. Anyway, thanks for reminding me. I will put it on my list, on my to-do list. Do a TikTok. Right. Well, I've got a question here. Question goes something a little bit like this. Oh God, pause due to poor connection. I'm going to push through it. I'm pushing through. I've heard saline implants can easily carry bacteria. So I wanted to know if there are other implant options. Saline implants can easily carry bacteria. Is that right? I don't know. Right. I should have Googled this before I came on. Well, what I would say is that we don't use saline implants much because silicone implants are better. So pretty much in this country, pretty much all the implants we use are silicone gel inside. There are different shells, so you can get a smooth one, a textured one, polyurethane one, but basically inside the implant, they're pretty much all silicone. They do make saline ones, but we tend not to use them. And if you've heard that saline can easily carry bacteria, I mean, the saline's sterile when you put it in. So I don't know if that's true that the saline can carry bacteria. I don't know if they've got a higher risk of infection with a saline implant. I'm not sure if that's true. I mean, the main problem is the silicone. I mean, even a saline implant has got a silicone shell. So if you said, I don't want any silicone in my body, I want a saline implant, you're like, fine, you can have a saline implant, but the shell is still silicone. But it's the shell that carries the bacteria, I would suggest, rather than the saline. I don't know. But in answer to your question, are there other options? Well, definitely yes, silicone. So as I say, the shell's always silicone, and the contents can be saline or silicone. And so the other option is silicone gel. So most implants that we use in this country are silicone gel rather than saline. And in my view, it's better to use silicone gel than saline. Saline's got a higher risk of rippling. Saline's got a risk of deflation. Silicone gel has a better feel to it and gives a better result. But if you have a thing that you don't want the gel in your the silicone in your body, as I say, there's still a silicone shell with a saline implant. But you know, if there's a particular reason that you might want a saline implant, then you know you can have a saline implant. But as I say, we very rarely use them in this country because I don't think they're as good. Personally, I think they're ripple and they're just, you know. But hey, it's just my view. Good. Okay. Next question, please. I saw Mr. Staiano do a Facebook Live where he briefly spoke about correctional surgery. How long after the surgery would it have to be to get corrected? Does that mean he tries not to do correctional surgery? What's that? How long after the surgery would it have to be to get corrected? Does that mean he tries not to do correctional surgery? Okay, I'll answer the second bit. How long after surgery would it have to be to get corrected? It depends on what the problem is in answer to that question. So if the problem, so first of all, easy answer, minimum 3 months, I would say, for a correctional surgery. We're not talking about complications, you know, hematomas and infections and stuff like that. You might need surgery early if there's sort of like an urgent thing. But if we're talking about sort of revision surgery, so it's sort of like looking a bit not quite right, then I would say minimum 3 months. And then it depends on what the problem is. If the problem's way off, if it's like, oh my Lord, that's up there and that's down there and it's all over the shop, 3 months would be the minimum. But what I normally say to people is it is not the end at 3 months. Things will continue to change. 3 months, they've only really started. So really 6 months, ideally 12 months, I would say, ideally 12 months, maybe even 18 months, and things continue to sort of change and evolve over, you know, even longer than 18 months. Now, one thing you've got to be careful about is if they've got a revision policy at the hospital. So if they've got a revision policy at the hospital 6 months, and then you say, oh, I'll leave it till 7 months, and then it's, oh, you're too late now. So sometimes in those situations, what we might do is put a revision form in at 6 months and say, look, I'm going to see you in a couple of months because I think it's getting better and you might not need the revision, but let's put it in before the 6 months of the hospital sort of acknowledge that. But in general terms, I think the longer you leave it for correctional surgery, the better. So when you say does that mean he tries not to do correctional surgery? Well, I think everyone would rather not have correctional surgery, both as a surgeon and as a patient. So I wouldn't say I try not to do it. I mean, I would rather it would sort itself out. But having said that, if it doesn't sort itself out, I've got a very low threshold to do it because I want to have happy patients. I'm very keen about having happy patients. I want patients to think that's a good guy and he's done a good job. So even if the problem is not that bad, even as a bit of a dog ear, it's not that much, and is, you know, I will have quite a low threshold to do revision surgery because I want to have a happy patient. But at the same time, I will advise you to leave it if it's starting to get better, and if it's only a little dog ear or something, I would say let's leave it another few months and see how it goes. So it depends on the problem. Minimum 3 months, ideally 12 months, I would say would be sort of ideal. But what's going on? What's going on? The only logical thing to do is make a TikTok of you dancing to Wig Wham Bam. What the heck is Wig Wham Bam? Wig Wham Bam. Are you saying something about I used to be called Wiggy at school? Can you believe that? Yeah, Wiggy. Look at me now, because I had an afro. I know. I don't know what Wig Wham Bam is. Wig. It's obviously a song, isn't it? I don't know. I'm not up with popular culture. Fascinating stuff, but I got to go and help folks out there who want to get their hair back. Take care, mate. Greg, you're a legend. Listen, anyone wants their hair back, Greg's the man. Greg's a good friend of mine. And thanks for dropping by, Greg, and getting the numbers up. Salma J96. Or you could do TikToks of you doing minor procedures showing before and after. Doesn't have to be dancing or lip syncing. Oh, you can do TikToks without dancing or lip syncing. Minor procedures showing before and after. Salma, how do I do that? Message me. Tell me how to do a TikTok of me. It's a song from the 80s, is it? Oh, right. Okay. Shouldn't I? I am not old enough. See, take notes. Yeah, dance. So, blimey, that's refreshing to hear that I don't have to dance or lip sync. Wow. Well, that's opened up my TikTok repertoire now. I'll do some. You got a consultation. Good, right? Okay. Well, I'll see you tomorrow, and you can tell me, or we can do one. We'll do a TikTok tomorrow of a minor procedure. No dancing, no lip sync. Awesome. I'll have a look at a TikTok. Thank you for that. That's reinvigorated my TikTok following. I feel bad for my followers on TikTok because they feel like I've neglected them. I'm sure all 4 of them, or however many there are. There used to be 4. There's probably 2 now. Probably 2 have dropped out. So thank you, Salma. Right, good. Blimey, I need to embrace this. Was there a question up there or not? No, just Greg was going because he's doing hair transplant. There's a question over here. What's going on? Question on Facebook. Over to Facebook. Kelly, I have more questions, believe it or not. I don't believe it. I frankly don't believe it. Will my B12 deficiency, pernicious anemia, affect any surgery I was to have? I'm thinking the tests that are done before surgery. No, Kelly. What I would hope is that your vitamin deficiency is being treated. And so as long as it's being treated and as long as you're in an optimum condition, then that's fine. If they're trying to find your levels and trying to get your levels right or trying to tweak any treatments you're doing, I would say, well, let them get that right first. But if your condition is stable, if you're being treated, whether that be diet or supplements, then I would say then that's fine. As long as you are, stable with that. Just want to say a massive thank you for arranging the bra donation collection in Africa that we have privileged to get involved with. Will you do it again? Good question, Nadia. I don't know. It's funny times, isn't it? Funny times with this. So I don't know if we'll do it again. But yes, thank you, Nadia, for your absolute amazing support on Macom. They gave us, how many was it? Anyway, loads and loads of bras that we could donate. So thank you for that. I don't know if we'll do it again. And I don't know what's happening with all the things that are going on in the world, whether we do something different. But that was amazing support by you, Nadia, and thank you for that. Big up yourself and shout out to you. Thank you for being a great sport. Thank you, Seeley. Well, thank you for making me do the mask, which totally messed up my audio. B12 patches available on Amazon. I use them. Oh, there you go. Kelly, there's B12 patches available on Amazon. I'm not sure that's good medical advice to be giving on my... yeah, that's Seeley saying that, Kelly, not me. Get your pernicious anemia treated by your GP, by your doctor. Don't trust Seeley. I don't know what qualification Seeley's got, but she's saying you go on Amazon. Don't do that. Seeley, stop it. Stop saying that. Well, anyway, there's B12. They deliver 10 times the amount of pills. All right. Right, we're not listening to Seeley because she's giving medical advice. I don't know about that. I'm not medical. There you go. That's her saying that. She's not medical. I am. I'm medical. I don't know about Amazon. I don't know about B12 deficiency. Get your GP sorting that one out. Right, move on quick. Kelly Hine, good question. I have PA too. Oh, there you go. We'll move on. We're back again. Do not trust me. Don't trust me. Don't trust Seeley. Don't trust me. Talk to your GP. We don't know what we're on about. But Jackie's got PA too. So that was a great question. Well done. So Jackie and Kelly, as long as your GP or whoever's treating your pernicious anemia is happy with it, as long as you're on supplements or as long as your levels are adequate, whether you're on supplements or not, then I would say fine. There you go. I have an injection every 3 months. There you go. Seeley, she has an injection every 3 months. Here we go. Olivia, I've got a bag of bras for you still under my bed, but I haven't seen you. Well, there you go. Well, come and see me and give me your bag of bras. Oh my God, Olivia's injection. Who knew pernicious anemia was so pernicious? It's everywhere. Pernicious, ubiquitous. Blimey, there you go. Olivia's got it as well. Flipping heck. Wow. Right. God. Well, on that note, what about this one, guys? What do you think about that? How long after pregnancy can I have surgery? Little twist on this question, because I think that's sort of a normal question. How long after pregnancy can I have surgery? And I normally say a year, a 6 month minimum, a year ideally. But that's the weirdest comment. Which one? Never. I've got the weirdest comment award. So normally when someone says how long after pregnancy can I have surgery, they're talking about body contouring, whether it be breast or tummy. And the answer to that is 6 months to let your body recover, ideally 12 months, so you have time for your body to sort of get back into shape, as it were. But this is saying scar revision on face, so nothing to do with body contouring. So if it's nothing to do with body contouring, and it's a scar revision on face, so I'm thinking that's a local anesthetic procedure, because one of the things about pregnancy is you're hypercoagulable when you're around the time of delivering your child. Your body is more likely to clot because it's ready for the sort of trauma of delivering a baby. So you don't want to have surgery too soon after pregnancy, because you're increasing your risk of DVT, because your body might clot. But that's really GA surgery, where you're sort of immobile. Scar revision on the face, you're not really that immobile. So I don't think there's any particular time limit, really. I mean, obviously you can have a small child, so you probably don't want to do anything that's elective. And let's face it, this is elective. A scar revision is elective, so you want your child to be a few months old, I guess. But I don't think there's any time limit on that one. If it's a scar revision on face, so that's a good little twist. It's a pivot on the pregnancy question. So I think if you're having a local anaesthetic case, I don't think there'd be any reason to have it not to have it at any time. I've got a bag of bras for you. You've got that's the weirdest comment. The bag of bras comment. Right. Well, we give bras to Africa. That's why, Seeley. So yeah, smalls for all. We're supporting a charity. I have B12. If you have an uplift without implants, do you lose a cup size or more? No. No, you don't. So you do lose a bit of volume, and I know people worry about losing a bit of volume, but it's not a huge amount of volume. It's only you take the skin when you do an uplift, so you're taking some skin out, so there is a small amount of volume, but you're looking at 15-20 grams, give or take, not a huge volume. And when you think of a cup size, is probably about 150 grams. So you're a tenth of a cup size. So I guess by some bizarre, situation, if you are right on the cusp between a C and a D cup, and you're very, very just in the D, you could be made into a big C, But really, broadly speaking, no, you're not going to lose any significant volume. And I normally say to people, the cup size should be the same. The shape will be different. They'll be lifted on your chest, but the cup size will be the same. Obviously, if you want the bigger cup size, then that's an implants. But it's a big deal having implants. So I always say if you're borderline and you're not sure how much bigger you want to be, then you could always have a lift in the first instance and see how you feel. If you wanted to be bigger, you could always have implants as a second stage. It'll be a perfectly reasonable way of doing it, and a way that many good surgeons would do it. Many very good plastic surgeons don't do it in one go. I do it in one go, but it's got a high risk of complications. So I tell people that it is thing. But yeah, breast lift without implants is a very reasonable thing to do, and you do lose a little bit of volume, but certainly not cup size. You have such a fantastic team too. You are Team Goals. We are Team Goals. That's Nadia, not me. We are Team Goals. Thank you. I'm a huge fan, and thank you for the info. I have to read to my kid now, but love this, so thanks. Right back at you, Seeley. Take it easy, yeah? Take it easy. Go read to your kids. Yeah. I should read to my kids, shouldn't I? Bad father. Not sure they care about that much anymore. But anyway, I will. I'll go and have a bash after this. But not right now, Seeley, because I've got a comment right here. Olivia, it's a WLS for the second time tonight. Someone's using a WLS. Now I know what WLS stands for, so I'm okay. It's a WLS surgery thing, JJ. B12. It's standard to have the injection every 3 months. I don't have a deficiency. Oh, you don't have a deficiency. Right. Well, I thought, okay. I thought you'd need to have a deficiency to have the... Oh my God, I'm lying. I'm going to turn on the TV. Okay. Well, that's good. Okay, well, good. So you need it supplemented. It's a supplement rather than deficiency. So I think pernicious anemia, I think it is a deficiency. I mean, I'm on the edge of my abilities here, but I think that will be a deficient, a low levels. But maybe if you've had bariatric surgery, it needs to be supplemented because you struggle to absorb it. Do you? Is that it? Anyway, yeah, fine. But that's good. Thanks, Olivia. It's not for weight loss surgery. Okay, so maybe it is for weight loss surgery as well, Kelly. I think maybe what Olivia is saying, people who have had bariatric surgery where they've had some kind of surgery to their bowel, they might not be absorbing it as well, so they might need it as well. But pernicious anemia is a condition of B12 deficiency. Oh my God, here we go. Oh my God, we're getting into, it's the white blood cells in your body. Oh God, here we go. Guys, it's the white blood cells in your body. All right. It's not weight loss surgery. Right. Okay. I'm a plastic surgeon. Get me out of here. Get me a question. Quick. Get me a question. Get me a question. There we go. Whoa. That was close. Why can't you improve my scar? Why can't you improve my scar? Right. What was the question? I'm out. See you, CV. Take it easy. See you next time. So this is a patient, a person, not a patient, because I haven't done surgery on him. Red blood cells, sorry. Okay. It's red blood cells, not white blood cells. So this is a person who is has got a scar on his head, and he said it's lumpy, and he has tried, I think he's had, oh God, I can't remember. I should have written it down. He's definitely had silicone gel. He might have tried steroid, and he's asking if things can be made better. Now, looking at the photo, and he did allow me to show the photo, but he didn't want his face to be recognizable, and it was just too hard to make his face not recognizable. I didn't want to get in trouble, so I'm not going to show the photo. But anyway, it was a scar here somewhere, I think, and it was pretty flat. It was a little bit red. I think it was 3 years old from memory. There's not much that I could do surgically, and I said I'd talk about it here. And I'm sorry I'm not showing the scar, but take my word for it. It's picture it, a line here. So if you're going to revise a scar surgically, there's got to be a problem. It's got to be raised, maybe. Well, surgically or non-surgically, if you're going to do things to a scar. If it's raised, you can do things, and that's when you get into the steroids and the silicone gels. You can excise it if it's raised, but that'll be an end stage thing to do. If it's stretched, if it's wide, if it's puckered, if it's dented in. So if there's a problem, so if it's wide, if it's dented, or if it's raised, you might be able to do things to revise it and make it better. But if it's just flat, and if it's just a bit red, it's really hard to do something about that. I mean, you could cut it out and stitch it up, but you'd be having another flat red scar. There's no guarantee it will be made any better. So, or the other thing is, if it's in a bad direction, you can change the direction of the scar. But we are limited as to what we can do for scar revision. And so it depends on what is a problem with the scar. And I think some, sorry, I think something happened there on Instagram and it left it. And I think Nadia asked me a question about implant? Or I've lost it now. Did it say what's your favorite implant or something? Anyway, so yeah, so it depends on what's wrong with the scar. So if there's something wrong with the scar, we can do something about it, but it's really for a stretched, raised, dented, bad orientation scar. If it's just maybe a little bit red, sometimes laser can help if it's red. If it's just a bit red, often time helps with it's red, so it's less than a year. I'd say let time help it. But I think this one was 3 years, and so I'm sorry to disappoint. But I find scar revision is one of those ones where I think people think we can do a lot more than we can. They think we can get rid of scars when we can't. We can only change them. So I know Nadia had a question. I don't know if she's out there, and I'm sorry that I lost you. I don't know what's happening on Instagram. What's my favorite implant manufacturer at the moment or something? The implants that I use are the ones that I've always used, and I've used them for a long time because I know the range, I know the books. Now, first of all, polyurethane implants, there's only one make. Makes it easy, Polytech. Polytech make polyurethane implants. If you want polyurethane implants, you have to have Polytech because they're the only company that make them. So that makes it easy. If you want silicone implants, there's loads of makes, and I don't think there's a lot of good ones, and I don't think there's any one best one. And I would be a bit wary about anyone saying these are the best, these are fantastic, these are the best, because we'd all use them. And so, in my view, I think there's a lot of good ones. And I tend to use Nagor. I use Nagor. As I say, Polytech makes silicone implants as well as polyurethane because I'm familiar. I'm familiar with Nagor. I'm familiar with Polytech. So those are the ones I would use if someone didn't have a view. But if someone had a view and said, I want Mentor or I want whatever, Sebin or there's loads of makes. Anyway, I can't think of any other makes, but there's lots. Urosurgical, but they're the same as Urosilicone, the same as the same company as Nagel. Anyway, if they wanted a specific make, and if the hospital could get that make, I'd be happy using that make. It's the dimensions you've got to look at, and the differences come. There are nuances with the texturing, but there are nuances with the warranty. So those are the things probably you've got to look at. They've all got the same silicone gel in them. And so I think you'd struggle to say that one silicone implant is better than another silicone implant. And I hear people saying, oh, this is the best and this one's really good. I'm like, and then the other thing you've got to be careful when they say that. It might be that's the only one they can use. If they work for a company or something, the company has got to deal with that make. Then they'll be, oh yeah, this makes brilliant. They're the best. Whoa, we've traveled the world and we use this one. Yeah, but I want to use that one. Well, no, you can't because you've got to deal with that. So if they've got a deal, they might have a vested interest. I've got no deals. I've got no vested interest. I can use any implant you want as long as the hospital can get them. So for me, I think they're all good. And I wouldn't necessarily say the ones that I use are the best. I think they're very good, and I think they're as good as the others, but I don't think they're particularly better. I'm just familiar with them, and I know the range, and I like them. So I think it's just a question of doing your research, looking at the differences, the pros and cons, and choosing one that you're comfortable with. And by looking, you can't tell what make of implant you got by looking. You can't tell that someone's got a certain make and say, oh, they go really good result. They don't give a better result. As I say, it's the way they do the texturing, which might have an effect on the capsular contracture rates, and it's the warranty. Those are the differences, really. Here we go. What's going on? Gastric red blood cells. I had a gastric sleeve surgery. All bariatric patients routinely have B12 injections every 3 months, regardless of whether we are deficient. So good. So thank you, Olivia. Oh, here we go. Oh my God, we started something. Oh God. Maybe after surgery, but mine's for the rest of my life. I cannot come off it. PA can be life-threatening without it. Wasn't your GA waiting list time now, JJ? Okay. Olivia changed the subject. Good. So I think we can ascertain that B12 deficiency happens in people anyway, which is pernicious anemia when you have a B12 deficiency. But also in some circumstances, I don't know much about bariatric surgery. There's a different sort of person who does bariatric surgery, which is the weight loss surgery. There may be some deficiencies and you may need to take supplements such as B12. So 2 groups of people who made those supplements, and we've got examples of both here tonight. So so good for the rest of their life. It's like, I'm worse than you. My B12's worse. No, my B. Right. What's your waiting list time now, Olivia? It's a bit. It's a bit. What's the word? Ad hoc, sporadic. We haven't got any regular lists to be honest with you, Olivia. We've got Simon Monkhouse. Yes, he's a bariatric surgeon. He'll know all about this B12 fiasco. Where is he when we need him? So it's ad hoc, Olivia, and we're just taking hand to mouth, Olivia. We're hand to mouth. We've had a couple of dates in September for local and sedation, and I think I'm not, to be honest, I'm not even sure. I think we've got some dates in October and maybe November. I'm not sure for local and sedation. So I think we got a few dates for that, and we just got one date in October for a GA. Which we just got that today. It's like, oh my god, we got a date for GA. So and hopefully, the idea is as the NHS start doing more, then the hospitals will start releasing more dates. One of the hospitals has already said to us, we're not doing any plastic surgery until January. So I'm telling people I didn't think it'd be till January, but as I say, we just got some dates in October in one of them. So it's it's a bit. I wouldn't say what my waiting list is. Everyone's just sitting on that waiting list, and we're just desperately trying to do people. But if we can we have got better availability with local and sedation, which I think helps everybody, because as we get people on the local and sedation list, then we can shorten the GA list, if you like. So even if you're not a candidate or you don't want local and sedation, the fact that I'm doing cases under local and sedation is helping the waiting list. So I'm really happy that we got availability with the local and sedation. So so I wouldn't like to say my waiting list is this, but I think for GA, I'm telling people it'll be in the new year, but it's good news that we're starting getting some dates now, which is good. You're a cracker, JJ. Thank you, Olivia. You're a cracker too, and I'm sorry to hear about your B12 problems. Simon Monk's house. I've no trepidation recommending you, and I do. I've no trepidation recommending you, and I do. Me. Also, thank you. Anyway, CD, thank you for that. Kind of you. That has been a roller coaster. I think you'll agree. I'm emotionally and physically exhausted. I'm going to have a lie down. I'm going to read to my children because that's the kind of guy I am. And I will see you right here, Facebook Live, 7 o'clock next Tuesday night. And that's going to be fun. So thank you for the B12 deficiency questions and others, obviously. Not just the B12 deficiency, but also other questions. I am going to sign myself out of here. I suggest you do likewise, and I will see